Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
There's a subject that many people don't discuss when they're having dinner parties, and that's, of course, colonoscopies, and maybe they should discuss it. But I have an expert here, an expert physician who is actually a gastroenterologist, and he is Dr. Seth Kirschner, and we certainly appreciate your coming for this radio show.
Thank you for having me. It's great to be here.
So, you know, Dr. Kirschner, when you had an opportunity to become a doctor, you had to think about what was it that interested you the most, and how did that all happen?
Right. You know, I always wanted to do gastroenterology from medical school. Gastroenterology is the best. Just being able to do a procedure, seeing patients in the office, and then again being able to do a procedure. And, you know, the procedures that we do, there's a lot you can do with them. You can do screening tests. You can do more therapeutic tests. You can do further advanced procedures. There's just so much you can do in gastroenterology, and that's really what caught my eye and why I wanted to do it.
So why do people generally come to you? Let's say they're not coming for a colonoscopy.
Right.
What kind of people do you see?
So all kinds of GI symptoms, abdominal pain, heartburn, nausea, vomiting, upset stomach, sometimes rectal bleeding, hemorrhoid issues. We see a vast majority and array of cases.
Yeah, so it's probably something that maybe is there, but people try to avoid it. It's not pleasant, right?
Absolutely. And it's, as you said, it's not the dinner talk conversation. But, you know, people obviously have real GI stomach issues, and then when they need to, they see this specialist.
So their primary care physician probably refers people to you.
That's
they
correct.
don't go directly, do they?
Majority of the time, we get referrals from primary physicians, but sometimes patients do come directly to us.
Okay, well, let's get down to this big word, the colonoscopy, which for years, I don't think people even knew to do that. When did that all start where there was a suggestion that they go every 10 years?
So there was actually more of a trend in the early 90s when screening procedures came more about to get a colonoscopy done, and it became more aware to get a colonoscopy done, again, for preventative, for screening measures. So what we do colonoscopies for, again, is for screening to look for polyps or abnormalities in the colon, which is a polyp that has a potential to turn into a cancer. And we go in with a colonoscopy, which we can discuss, and if there is an abnormal growth, we remove the growth right there so that abnormal tissue doesn't turn into a cancer down the road.
So when you say abnormal, so let's say you see a polyp.
Right.
And it is, you know, it doesn't have any, you know, cancer at the moment. Do you take it off or you just watch it?
We do. So when you go in with a colonoscopy, the main reason for a colonoscopy, especially in a screening population or in any procedure, is when you go in and if you see something that looks abnormal, an abnormal looking growth, and you can tell that very easily visualizing during the colonoscopy, immediately right there we have different techniques to be able to remove the polyp. Whether we'll biopsy it off or stare it off, there's multiple techniques that we can use to remove a polyp. And once that polyp is removed, gone. It has no further chance of turning into a cancer, which is why colonoscopy is such a great tool, that we can use it where something was there and had the potential to turn into cancer down the road. It's now gone and does not have a chance of turning into a cancer.
So what's the percentage of people who you do colonoscopies on actually have a polyp and are clean?
Right. So the polyps that you're referring to that have the potential to turn into cancer, it varies between men and women. On a national average, the more significant lesions are found about 30% of the time of the polyps in men and 20% in women. National average between the two is about 25%.
Ah, so there are people who are, I think I had one, and they just had nothing. And
exactly. So the majority, conversely, the majority when they get their screening colonoscopy, and we talk about usually that's at the age of 50 when people are recommended, unless there's a family history of other factors. Majority of people are recommended to get a colonoscopy at 50 years old. And the majority of those people have a negative colonoscopy, meaning no polyps are found. But that's not everybody. Again, at least 1 in 4 can have an abnormal lesion or a polyp, an abnormal growth found, and that can be removed.
And so let's say you haven't had anything. How often should you go back?
So again, it depends. It depends on family history. It depends on symptoms. For the average asymptomatic, no symptom patient, the recommendations are to have a colonoscopy at age 50. Now, there are variations to that as well. Again, medical history. There's new data coming out to support that in the African American population, screening colonoscopy should be pursued at 45 years old. But in general, for the average American who's asymptomatic, not having any symptoms, 50 years old is the recommendation.
Okay, now they've had it at 50 now, what? And there's been no problem.
So by the book, in the recommendations are if the prep is good and everything was seen in the colonoscopy, you don't need another repeat colonoscopy for 10 years. So you had it at 50, no polyps, everything was seen, everything is good. You need a repeat colonoscopy in 10 years. Now, again, everything is on an individual basis, and you want to discuss with your physician, again, the quality of the preparation and see if they recommend a repeat colonoscopy in 10 years for you. But the majority of the time in this example that you're bringing up, it would be a repeat colonoscopy in 10 years.
So every 10 years?
Every 10 years.
60, 70, 80,
exactly.
90, 100.
Again, unless a polyp is
Yes.
found or unless some area is not visualized very well, and then you may
And
need
if
it
there is
sooner.
a polyp, so then you want them in sooner.
Exactly. And it depends on, there's different types of polyps. When we look at a polyp, we send it to the lab and the physician will look at it under the microscope. And there's different types of polyps that it can come back. And then the intervals vary, whether it be 1 year, 3 years, or 5 years when a repeat colonoscopy would be needed.
I have a friend who loves broccoli. Now, if someone eats a lot of broccoli, is that going to help?
So vegetables in general are recommended. Not necessarily broccoli, but yes, overall vegetables, I would recommend a diet high in dairy, fruits, and vegetables. Other things that they've looked at to help potentially protect against colon cancer, things like fiber. Now, that hasn't been substantiated yet. It's still in clinical trials. But again, dairy, fruits, vegetables, some other things that are in clinical trials that are looking at as well is calcium supplements and vitamin D. So these are all things to discuss with your physician when you sit down and talk about a screening colonoscopy with your physician.
All right, and how young could someone be? I mean, have you done colonoscopies on teenagers?
So we do. I work in the adult population. So there are pediatric gastroenterologists who would do colonoscopies on patients who are 18 or less, younger than 18. I usually see patients who are older than 18. I have done colonoscopies on patients that young. Again, it depends on their symptoms. If they're having significant abdominal pain or if they're having rectal bleeding, they may warrant a colonoscopy. Again, if for a family history, somebody may warrant a colonoscopy earlier than 50 years old. So again, it's another reason to discuss with your physician when the best time for colonoscopy is for you.
You know, I think, and I interview a lot of doctors with in specific where it's not just typical specialties, and I think that the students, whether it starts in junior high, they should know about these things. I think we don't talk enough about that, and I'm sure you agree with that.
I agree with you wholeheartedly, and especially knowing your family history and knowing that mom or dad had colon cancer diagnosed at a specific age. Well, you may have to get it done in your 20s or 30s or earlier, depending on when your family history was diagnosed with colon cancer.
But even without that, I think it's it's important for people to know about everything. So
it is.
Let me just talk more about you now for a moment.
Sure.
My guest is Dr. Seth Kirschner, Kirschner, and you are with the organization called Digestive CARE, caring for your digestion, right? Enjoy life. Let them take care of you. And I'd like to give you a phone number if you haven't had a colonoscopy. So why don't you call them, and then you can go directly. You don't even have to go directly to your primary care physician. It's 954-344-2522. Again, 954-344-2522. And I love your website's name. It's LoveMyGI.
It's a great name.
It's great.
Unfortunately, I can't take credit for it, but
okay,
it's a great name.
But that's why. You seem very lovable, and I'm sure that's why it was there. So they are experts in gastroenterology, and they now do accept Medicare Advantage plans, Medicaid Advantage plans, 2018 Marketplace plans. And so why don't you give them a call, and if you're having a problem, and if you're not having a problem, call them for a colonoscopy, right?
Absolutely.
So let's just talk a little bit about what you do in a colonoscopy.
Sure, absolutely.
Tell us so a patient comes in,
right,
and they first have to do some prepping before, right?
Right. So some people may have heard a little bit of a stigma behind colonoscopy. It's really not that bad. The day before the procedure, the patient will be on a liquid diet, and there is a prep. There is something that you need to drink the day before to help clean you out, to help clean out the colon, so that when we go in for the colonoscopy, we can visualize and see what's going on inside the colon. That's it. Besides the liquid diet and the prep, the patient's job is done. They come in to wherever we're doing it, whether it be a surgery center or in the hospital. Most places use an anesthesiologist. We will put you to sleep with anesthesia. Some other docs use a sedative. And once you're asleep, the colonoscopy goes in the rectum all the way to evaluate the colon, again, looking for any abnormal lesions like we talked about. Majority of the time, the whole procedure lasts anywhere from 15 to 20, 25 minutes. Patients wake up, they say, I feel great. That was the best sleep I've had in a while. And that's the end of it. And then the patient gets the results at the end of the procedure. We tell them what they found and when to repeat the colonoscopy. And it's an outpatient procedure, so patients are able to go home that day.
Okay, so the couple of questions I just had before we, time runs out so quickly when we do our radio shows. But number one, if you do see a polyp, you remove it at that point.
Remove it right there, correct.
And if you don't, and someone wakes up, should they not have someone drive them home?
Patients should have someone drive them home, especially when they've had anesthesia. We wouldn't want somebody who had just had anesthesia driving home on their own. So we do recommend that you have a ride. If somebody, for whatever reason, doesn't have a ride, we can provide a ride for them through ride services or things like that.
Right. Okay. And you should, I'm sure, you have to have all their medical background so you understand, because this is serious. If you have it, whether you have just an injection. Now, what's the difference of having anesthesia or there's something else? What do they call it?
A conscious sedation.
Conscious sedation.
Right. That depends on the physician and the group you go to. Us here in Digestive Care, we only use anesthesiologists and anesthesia, which from our preference as well as the patient's preference, we prefer. I think it's better from the patient. They're completely sedated. They don't feel anything. They're out for the procedure. And it makes it a little bit easier on the physician, too, when the patient's asleep and not moving around.
Right. I'm known to ask funny questions.
No problem.
When did you have to have your first colonoscopy? I was thinking that as a physician, you should know what it feels like.
Right. I actually have had a colonoscopy before. I have. So I have gone through it. And from my personal experience, the colonoscopy was not bad at all. It was simple and easy to do from my standpoint.
Right. And I'm sure the worst problem is when people don't have them and they should. Because tell us, just what can happen if they don't.
So the biggest, again, reason why we do this procedure and why we advocate people to get a colonoscopy is this screening test to remove any lesions that may be harmful down the road. If, for example, somebody doesn't have a colonoscopy under the recommended guidelines and there is something there that could have been removed that potentially now turns into cancer down the road, well, now we have to take other steps. They may now have to go for surgery to remove potential colon cancer. And of course, we want to find something before it spreads, before it gets larger and it spreads to other parts of the body. So that's why we advocate doing colonoscopies as early as recommended, so a lesion isn't missed and it doesn't turn into something more aggressive down the road.
So now if someone does have to have surgery, do you have surgeons in your practice?
We don't have surgeons in our practice, but we have very good relationships with surgeons throughout the greater Broward community. We actually have a very good surgical group in our building who we use a lot. So we can make recommendations to a general surgeon or a colorectal surgeon if needed.
So that's really what the term is, colorectal.
Colorectal surgeon,
Okay.
Correct.
My guest has been Dr. Seth Kirschner, and he's a physician at Digestive Care. And I'm going to give you the phone number to call. Get your colonoscopy now, or if you're having any problems, call them, 954-344-2522. Their website is lovemygi.com. Thank you for being here.
Thank you so much for being here.